Hello class, you're welcome back. So this lesson was centered on scene survey. Scene survey. Remember that scene survey is the first step during emergency scene management. Emergency scene management comprises of everything you do during first aid, and your purpose is to lessen the impact of emergency on your patient. Okay, remember that first aid, the primary objective of first aid is to prevent more injury, preserve life, promote recovery, and it entails series of activities. So there's always the starting point and of course the point of exit. So in between the time you start and the time you stop, there are series of activities, and those series of activities are together geared at reducing or even eliminating, hopefully minimizing, lessening the impact of emergency on the patient. So I hope you recall from the previous lesson that ESM comprises of 4 broad steps. Okay, step 1 is scene survey. Step 2, primary survey. Step 3 is secondary survey, yes, and then ongoing patient care. Okay, so this lesson will dwell on scene survey. What is scene survey? Scene survey is simply surveying the area where the emergency has occurred. Then why are you surveying the area? Because your safety is important. So you're surveying the area to peek, to dictate, to know if there are dangers, if there are anything that can constitute a hazard. Remember, a hazard is anything that can harm a person or even kill a person. There is no environment that is hazard-free. There is none. There is none. Even in the house, there are a lot of hazards. In the kitchen area, dining area, in the place of work, when you walk on the road, the moving vehicle, the snow on the ground, okay, the knife you use in the kitchen, the boiling water, the wet floor, even your carpet. Okay, so we are living in environment that could have a lot of hazards. So you have to assess that area before you start. So the primary reason why you do, there are 3 main things, and 3 main things you do here. And then, of course, there are also other ones that I'm going to, but the 3 primary, 3 most important is scan the area. Scan the area for what? Safety. So your safety is the primary objective. Your primary safety is number 1 reason why you must scan that area. Don't take this thing for granted. Don't undermine this. Don't overlook it. Because if you do, you may become a victim yourself. So this is not something you skip. You can't skip this. This is the reason why it is number 1. It is not by accident. That position number 1 is not there by accident. It's not as a result of accident. It is intentional because your safety is number 1. So again, another thing is your protection. Okay, protection, your protection is also important. Safety and protection are not necessarily the same in this context. We know that safety measures target physical hazards. Physical hazards are the hazard that you can use your 5 sense organs to dictate. Of course, when you do sense survey, you're using your sense organs, the eyes, the ears, the nose, you can smell the gas, you can feel the heat. So you're using the sense organs to do the assessment of the area, targeting physical hazards, okay? But there are biological hazards that you may not be able to dictate using your five sense organs. So those hazards, like bacteria, like virus, or viruses, they are very small, very microscopic. You will not be able to dictate them using your five sense organs. So you must have measures to prevent the transmission of disease through those channels. Okay, so this is where you need your gloves, you need the mask. You know, if you're doing CPR, you need to breathe into your patient, so you need to protect yourself. You need to use your gloves. If you're dealing with the blood, you're dealing with the fluid from the body, urine, vomit. So you need to protect yourself adequately. You need hand washing, which is number one, the traditional, the best way to actually protect yourself from transmitting or contracting disease is a hand washing. Hand sanitizers, they are also there. There are other measures depending on what you're dealing with. So protecting yourself is number one. Remember, there are 4 ways disease can transmit. There are different ways disease can move from one point to another point. Direct contact is one of the ways. Direct contact. So number 2, indirect contact. Indirect contact. That's another way diseases can move around. Number 3 is airborne. Airborne transmission. This one is one that circulates through the air by breathing. Then you have number 4 is vector. Vector-borne. Vector-borne is when somebody gets disease from animal bite or insect bite. A good example is malaria that is transmitted by mosquito. So you need to protect yourself from either transmitting or contracting. Remember that there is nobody that is not potentially infectious. Every person, including your patient, okay, is potentially infectious. So that's the more reason why you must be proactive and you must protect yourself, because there is nobody that is not potentially infectious. Okay, so you can contract disease from the person. The person may be a millionaire, the person may be a professor, the person may be a doctor, it can be a nurse, it can be a teacher, it can be an instructor, it can be a child, it can be an infant, it can be an adult. It doesn't really matter. Your status does not matter. I need to protect myself because you are potentially infectious. I am potentially infectious. I must protect myself. Okay, so number 3 is permission. So you also need to obtain permission here. This is where you seek permission or consent. Okay, consent. So during this stage, your safety is number 1. Your protection is important. You need to obtain permission. And this is where you approach your patient, introduce yourself. My name is John. My name is Tim. I'm trained in first aid. Can I help you? So that is consent. When you said, can I help you? That is consent you're looking for there. So consent could be voluntary. That is, if your patient tells you yes or no, either verbally or non-verbally, that is voluntary. It could also be implied if your patient is unconscious or your patient is not legally of age. So you can go ahead and help that person, especially the person who is unconscious cannot respond. So you can operate within the context of implied consent and go ahead and help that patient. Okay, so your safety, your protection, obtaining permission, very, very important. This is also where you ask some questions. So number 4, you ask some questions, some important questions, like how many patients are involved? Like, do I have people around to help me? Like, what could have resulted in this? What could be responsible? Mechanism of injury. How did the patient get there? So you may look around. You may get some clue from the environment. Or if there are witnesses, they may tell you what happened. We call it the mechanism of injury. What actually happened. What led to that situation, to that condition. So that is what scene survey is about. Very important, very crucial. You don't overlook it, because again, the reason why you don't overlook it is because there are hazards everywhere. If you overlook it, if you are so zealous, you don't care, you just want to jump into this, you don't look at surrounding area, you didn't make a kind of 360 degrees, look up, look down, look around, make sure that it is safe, make sure you protect yourself so that you don't contract disease, make sure that you obtain permission before you proceed, and ask all those necessary questions. How many patients? Do I have help? Should I screen? If I screen, do I have people? So you need to hear for help also. You need to, ask what happened? What happened? Try to figure out what happened. What the mechanism of injury? What led to this? So those are things you do during scene survey. And then if all these are okay, safety is okay, you check mark it. This is okay, you have protected yourself, you obtain permission, possibly you get answers here, okay? And then that will now lead you to step number 2, which is primary survey. Primary survey will be the focus of the next session. So does anybody have any question? Okay, yes, I said it. Everybody is potentially infectious, yes. Yeah, you can take me to anywhere, I can prove it. Anybody, whether he's president of a country, what is the most powerful person on this earth is potentially infectious. Do you know what runs in that person's blood? You don't know. So if I assume that the prime minister or the minister or teacher or my parent or anybody, my instructor, my co-worker is potentially infectious, I'm not committing any crime. That is true. In fact, you should make that assumption at the initial stage. That is what will even motivate you to protect yourself. So it's a good thing to actually assume. Okay? Thank you so much for that important question. So in the absence of any other question, we're going to end it here. And then the next session will dwell on primary survey, which is the pillar of first aid. I can't wait for that session. Thank you and see you then. Bye-bye.